Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today we'll be talking about hip problems with board-certified orthopedic surgeon, Dr. Timothy Lukas. Dr. Lukas, welcome back to the program.
Thank you for having me back.
Let's start with doing a review of the anatomy of the hip.
Okay, we'll bring up our diagram. So the hip is a large weight-bearing joint. It's made basically out of a ball and a socket. The ball and the socket are both covered by this tissue, the cartilage, which is the cushion between the two. In addition, you have the joint lining and a lot of muscles that surround the hip that help you, walk and ambulate.
What are the main causes of hip pain?
The main cause of hip pain is arthritis. Wear and tear type of arthritis tends to be the most common, but there are other things that can cause problems in the hip as well. Tears in the joint lining or labral tears, cartilage tears. There's some unusual things that can happen that can cause hip pain as well. A condition we call avascular necrosis, where the bone actually starts to die off. Some weird, difficult things to diagnose, but that can affect the hip as well.
You mentioned arthritis as a common cause of hip pain. Can you talk a little bit more about that?
So again, the most common type is wear and tear arthritis or osteoarthritis. The vast majority of people that have hip arthritis, that's the type they have. Basically a wear and tear process over the years. Injuries tend to accumulate and build up and get worse over time. There's also other types of arthritis though, autoimmune types of arthritis, rheumatoid arthritis, and that's a different process. In rheumatoid arthritis, the joint lining of the synovium tends to be affected, and it tends to proliferate or spread and cover the cartilage, so it kind of suffocates the cartilage, and that's what causes the cartilage to die off or get destroyed in that process.
What are some of the symptoms of osteoarthritis of the hip?
The main symptom most people have is groin pain, and usually it's with weight bearing and at night. So when you're walking around, if you have groin pain, that likely is from the hip joint. You can also get referred pain down into the thigh and occasionally even the knee that comes from the hip. So just because the pain is not directly over the groin doesn't mean it's not the hip that's involved.
So for those folks that are at home that are having some of these symptoms that you're talking about, sometimes people say, oh, it's age and things just aren't working like they should, it's a little painful. How do they know when they should go to their physician and seek treatment?
Sure. So if they're having consistent pain that limits their walking and normal function, if they're limping, if they're having a hard time getting out of bed in the morning and being really stiff in the morning, those are the things that you want to get checked out.
Dr. Lukas, this is great information. We need to take a break. We'll continue our conversation in a moment.